Hi, everyone. For this week's discussion, I wanted to talk about the problem of dual diagnosis. This refers to when clients experience both a chronic psychiatric disorder and a substance use disorder. Treating these clients raises a number of ethical and therapeutic considerations that really impact how we, as future therapists, approach our work. From an ethical perspective, one of the biggest challenges is accurate diagnosis. Substance use can mimic or hide psychiatric symptoms, so there's always a risk of misdiagnosis. That means we have a responsibility to assess carefully, often over time, to avoid overlooking part of the client's condition. Another ethical concern is the fairness of care. Many treatment systems still focus on either mental health or substance use, but not both together. Realistically, that leaves dual diagnosis clients undeserved and puts them at a higher risk of relapse, hospitalization, and poor outcomes. For certain vulnerable groups, like women with dual diagnosis, there are added risks such as victimization or losing custody of children. So it's critical to provide trauma-informed and respectful care. On the therapeutic side, research shows that integrated treatment addressing both disorders at the same time is far more effective than treating them separately. Clients with a dual diagnosis often struggle with relapse and poor treatment retention, so therapists need to use flexible, long-term approaches. Motivational interviewing is a perfect example. This tool avoids confrontation and helps clients see their own reasons for change. And because dual diagnosis affects so many parts of life, like employment, medical health, and even housing, therapy often has to be holistic, involving multiple systems of care. Finally, when I think about how dual diagnosis impacts my own theoretical framework, it really pushes me to be more flexible. No single model feels like it's enough, especially for clients who are managing both a psychiatric condition and substance use. But for me, it has influenced how thinking to be more integrated in multiple approaches, even if my framework, while still making sure treatment is individualized for each client's needs. In practice, that means drawing from different theories like cognitive behavior strategies, motivational interviewing, and even psychodynamic insights when appropriate, but always tailoring the plan to fit the unique challenges that dual diagnosis presents. I see myself leaning towards an integrative approach, but one that leaves room to adjust depending on the client in front of me. So in short, dual diagnosis clients make me think less in terms of rigid theories and more in terms of combining tools in a way that respects both their vulnerabilities and their strengths. Thank you so much for listening.